So at the Center for ACL Injuries, we take a very individual approach to treatment. We're going to talk to you, try to determine what your injury was, what you hope to do, and then based on that, we can decide what's the best treatment for you.
In the 40 years I've done this, ACL injuries and the treatment of ACL injuries has evolved from an inpatient procedure, big incisions, four-day hospital stay, and a year recovery, year and a half rehab. We now can do a better job, technically, outpatient procedure, arthroscopic, rehab that takes 6 to 8 months and back to play in usually 8 months or so.
When an athlete tears their ACL, it's typically a sudden event, and they know something happened in the knee. They often hear or feel a pop in the knee. There's usually a pain associated with that. It's often very difficult to resume the sporting activity, even before swelling sets in, because they sense instability to the knee. The knee is not reliable.
After you tear your ACL, you have some time to decide what to do next. Obviously, you'll have swelling and you'll have pain, and that will require elevation and ice and maybe some anti-inflammatories. You might even require some crutches. You'll want to see a doctor within the next couple of days to have your knee fully evaluated.
When a patient elects to proceed with anterior cruciate ligament reconstruction, we have a conversation about the source of graft. And then depending on many variables, including the patient's anatomy, prior surgeries, age, they contribute to deciding whether we use autograft or their own tendons or allograft or donated tendon.
What we try to do is individualize the graft choice to that patient's injury, to their activities, their sports, and we try and match the graft to that patient and expect that they'll do well with that graft choice. So what might work for one athlete may not work quite so well for another athlete.
ACL injuries are not usually an isolated event, and what I mean by that is they don't usually occur alone. If you tear your anterior cruciate ligament, you often injure other structures within the knee joint. At the Center for ACL Injuries, we have the ability to take care of not only the ACL tear, but all injuries that occur with that tear.
Well, the patients are obviously concerned about the pain, and they've heard horror stories about someone who just had terrible pain. So knowing that, we address that early on in the office, answer the questions, and then do several things preemptively in surgery, after surgery, to make it as minimally painful as possible.
We collaborate closely with the anesthesiologists at the surgery center, who are very adept at outpatient surgery. We employ polar care or ice machines that both reduce after-surgery pain and swelling. That is quite effective. Patients love those. Our surgical techniques also contribute to reducing after-surgical pain by minimizing surgical morbidity, especially with the hamstring graft, and that goes a long way to reducing the trauma and improving patients or exceeding patients' expectations for after-surgery pain.
So the typical course is a patient comes in for surgery. If the surgery is at 7, they'll arrive at the surgery center about 6. Surgery starts at 7. They'll be in recovery room by 9 and usually ready to leave recovery by 10.
The Center for ACL Injuries is for everyone. So whether you're a high school athlete, a weekend warrior, or you're someone who's pushing the active lifestyle boundaries as you get older, we're here to treat everyone.